Good afternoon. Today we're going to share some details on the efforts our communities are taking to push back against COVID-19 and an update on the situation with respect to unemployment support. First, I'll give a quick update on the latest COVID numbers. Yesterday, DPH reported there were 9,439 new individuals tested by molecular tests. That brings us to a total of over 1.8 million individuals being tested and over 2.7 million tests conducted. Massachusetts continues to be a national leader in the amount of testing we're getting done here in Massachusetts. We saw lower test totals over the weekend, but that's not surprising given that it was a holiday. Last week, the Commonwealth averaged about 42,000 tests per day compared to about 33,000 tests the previous week. Part of this increase is from college students and faculty getting tested as they return to campus, and DPH will start to report data for college testing shortly. The information will be updated every day and is another important piece of the data that we'll use to guide our response to COVID. The 7-day average positivity rate is very low at 0.9%. We're continuing to see excellent progress across the Commonwealth. But there are some communities, and we've talked about this before, that are continuing to see increased positive test rates. And in a handful of cities, we've been focusing on our efforts with local officials to deal with dangerously high levels of transmission there. Did somebody just turn on the mic? Oh, okay. Over Labor Day weekend, we ramped up ground efforts in 5 communities that have been particularly hit by COVID: Chelsea, Everett, Lawrence, Lynn, and Revere. We launched a new set of tools through the COVID-19 Enforcement and Intervention Team to increase enforcement, education, and public health resources and awareness in these communities, and this included multilingual public awareness campaigns. These resources are being deployed in collaboration with local leaders and with law enforcement and local boards of health. We all have the same goal, which is to keep COVID out of these communities and to do everything we can to help keep their people safe. Over the weekend, we had field teams meet with residents and business owners in Chelsea, Everett, Lawrence, Lynn, and Revere to distribute information from those locations, and these field teams had about 35 volunteers at 16 locations across these 5 communities, from beaches and standouts in high-volume areas to church and food pantry visits to stopping by and visiting businesses with a lot of traffic like grocery stores. The teams handed out over 500 signs and 17,000 flyers with community-specific information on how to stop the spread and keep people healthy both inside and outside the home. They also distributed almost 4,000 bottles of hand sanitizer. This weekend, we'll also be adding Framingham to this group. In the 5 persistently high-risk communities mentioned before, the Division of Professional Licensure made 92 inspections last week across businesses like funeral homes and nail salons and barbershops. They found a total of 47 COVID-19 violations in these facilities, and the state police are assisting local police with COVID-related enforcement as well. Over Labor Day weekend, state police were in Brockton, Revere, and New Bedford to support local efforts, and they also launched dedicated patrols in DCR properties and on the water up in Gloucester. The Alcoholic Beverages Control Commission, known as the ABCC, is doing a terrific job of staying on top of compliance at licensed establishments. Just last week, those enforcement operations were conducted at over 1,200 establishments statewide. 900 establishments were found to be in compliance with the Commonwealth safety guidelines, and the others were fined or issued warnings. We're pleased that a vast majority of our restaurants and their customers are enjoying their experience, outdoor dining, indoor dining safely and appropriately to prevent the spread of COVID. And we really appreciate the ABCC's ongoing work to ensure that establishments are operating based on the guidelines and advisories that have been issued by the Commonwealth and by many local communities. Since August 11, our administration has released a weekly report and a color-coded map based on the number of new cases in each community, and each community has been designated as a high, medium, or low-risk community. Communities that have fewer than 5 cases aren't given a designation for what should be obvious reasons. We spend a lot of time focusing on the communities that are seeing higher rates of COVID to raise awareness and help those communities drive down cases. But it's also important to note that the vast majority of the 351 cities and towns in Massachusetts have done a great job following the guidance to reduce COVID-19. And this data shows that their efforts have been paying off. 190 cities and towns, or 54% of our communities, have recorded 5 cases of COVID-19 or less in the entire community since mid-August. 46 cities and towns, or 13%, have reported less than 4 cases per 100,000 residents. They're designated as low risk or green on our maps. And 47 communities have improved their standing in this assessment by reducing their percentage of positive COVID cases over the past several weeks. For example, Springfield has recently moved from moderate risk to low risk and has stayed green for the past several weeks. Salem and Saugus have also moved from high risk down to moderate risk and have done a lot of good work to get there. This demonstrates the solid progress communities can make if they focus on the many criteria and opportunities and protocols that we've discussed previously. And much of this progress has allowed us to significantly reopen much of our economy here in Massachusetts. And just want to commend our residents and our local officials for their effort to contain COVID, and especially the businesses across every sector who've stepped up and changed their operations to follow the COVID-19 safety guidance. This progress, with the support of many folks in the public health community and our pediatric community, now allows the Commonwealth to get children back to school for in-person learning as we begin the new school year, and it allows for several colleges to return to campus live, to learn in, and to work in our communities. As we've said, COVID didn't take the summer off, and we don't expect it to take off the fall either. We'll still be fighting it until there's a treatment or a vaccine, so everybody needs to continue to be vigilant and do the things that have proven to be so successful here. Wearing face coverings, practicing social distance, and staying at home if you're sick. Finally, I just want to provide a quick update on our work to distribute federal unemployment benefits that were created under a special FEMA program under a presidential executive order. The Lost Wages Assistance Program was implemented by a federal executive order in August, following the expiration of the federal Pandemic Unemployment Compensation Program. This program allocates funds from FEMA to provide an extra $300 in weekly unemployment benefits for claimants. Massachusetts applied for this new program last month and was approved. This approval applies to both the traditional unemployment claimants and to claimants under the Pandemic Unemployment Assistance Program, which was created by the CARES Act for self-employed workers, gig economy workers, and others who don't participate in what we think of as the traditional unemployment assistance program. Since the feds approved our application, the team at the Department of Unemployment Assistance has been working to develop the technical infrastructure and reporting capabilities that are required to implement the program so that we can distribute these resources. Eligible claimants do not need to take action to receive these benefits. They'll show up on a retroactive basis in your account. The retroactivity goes back to August 1st. Last week, Secretary Rosa Costa's team at the Department of Labor was able to start distributing supplemental benefits to pandemic unemployment assistance claimants. The PUA claimants received their first 3 weeks' worth of retroactive payments last week, and those benefits covered the first 3 weeks of August. Next week, those PUA claimants will receive the following 2 weeks' worth of retroactive benefits as well. So far, we've been able to distribute over $200 million in supplemental benefit payments to PUA claimants. That number will increase next week when the additional retroactive payments are made. Around 235,000 PUA claimants are now receiving this expanded benefit. Separately, under the traditional part of the program, the DUA benefits will be retroactively distributed as well over the course of the next few days. We're very glad that Massachusetts was able to quickly install the software and the technology and the reporting requirements that were necessary to stand this up and to make this work under this federal program. It's an important step in ensuring that we sustain supplemental relief for people who are out of work here in Massachusetts through no fault of their own during this pandemic. But as we said before, this program is a diversion from the FEMA program, which was appropriated funds for the so-called disaster attached to COVID-19, and it should not be considered, and isn't, a permanent or sustainable solution. As I said before, and so have many other governors, Republicans and Democrats, it's important for Washington to step up and do what they said they were going to do last summer, which is to implement a COVID-19 relief package that supports a longer-term, more traditional unemployment benefit program, and to support the states and localities that in many cases have borne much of the burden of making sure that their communities are safe. People in both parties need to come together to make this happen sometime soon. It's the right thing to do for workers who lost their jobs because of the measures many of us had to take to stop the spread of COVID-19, and it's critically important to ensuring that state and local governments can continue to support their communities as we work our way through the rest of this pandemic. Thank you.